Psychosocial is really the fusing together of psychological and social, and it's about how people think and feel and react, and how they're dealing emotionally and mentally, but also how they're interacting with people, so friends and neighbours.
What we're doing is getting alongside people, providing some information and some emotional support to help people's own natural recovery.
So with psychosocial recovery, there's a pyramid of psychosocial support. At the top end of the pyramid is very targeted specialist supports. So that would be acute mental health services. And then there's kind of a targeted supports below that. And below that, supports to people, to individuals, to families and communities. And then very much there's this universal supports which are put in place, which is things like the All Right campaign. Our space isn't the specialist services, so lots of the things that we've done, like Bounce, like the support to the bereaved and seriously injured families, like the Recovery Matters workshops and the PFA, have all been aimed at that bottom end of the psychosocial pyramid.
Our psychosocial training materials, which include psychological first aid and the Recovery Matters workshops, was really developed looking at best practice internationally. So we used experts such as Dr. Rob Gordon from Australia and his experience with the bushfires. We also looked at some of the best practice from organisations such as the World Health Organisations.
There were a lot of people living in recovery while working in recovery, and so to stop that sense of disillusionment with not being able to fix people's problems, and also to prevent burnout, the recovery workshops were developed and then extended out to be offered to community groups and workplaces.
Recovery Matters is a fantastic tool. We deliver it through workshops. So workshops in the workplace or workshops in the community. And it's really aimed at providing psychosocial education for people. So it kind of explains why people are feeling the way that they're feeling right at this moment. It describes the journey that they may have been on as a result of the disaster. It talks around the roller coaster ride that they may have been on in the journey, and talks through stress and provides strategies on how to cope with stress.
Even though people's paths to recovery are very individual and are different, we can see the patterns.
We made sure that our staff, our volunteers, have been trained to make them aware of some of the behaviours that they might encounter, that people might be angry, and actually it's not you they're angry with, it's everything else that's out of their control. And they might be angry with you because you're a safe person to be angry with as well.
PFA is psychological first aid. It's the psychosocial equivalent of a medical first aid course. Just in the same way you don't have to be a doctor to provide first aid, you don't have to be a psychologist to provide psychological first aid.
Staff as well as volunteers have psychosocial training and PFA, so we know how to care for ourselves and how we can properly support the people who are stressed.
We've had a very positive response from the workshops. Comments like, "It's so good to know that I'm not alone, that other people feel the way I do." "Oh, I thought I was slow in recovering, but now I realise that actually it takes a long time." It's really empowering for people. That sort of aha moment that people have had when they've understood a bit more about the effects of long-term stress, or that they've understood that putting in place some quite simple strategies can actually be really effective in terms of their own recovery.